The practice of medicine was very different when Mercy Hospital, Pittsburgh, opened its doors on January 1, 1847, in response to a smallpox outbreak. Germ theory was yet to be discovered. Anesthetics like ether and chloroform were just beginning to be used. Hospitals were often seen as places of death instead of healing. The Sisters of Mercy set about creating a different vision of healing, changing fear into hope. Mercy Hospital was the first permanent hospital in Pittsburgh and the first Mercy Hospital in the world. Many more would be established throughout the United States. In them, everyone was welcomed, regardless of race, nationality, age, gender, or religion. The effort to provide health care through hospitals was one of struggle. Less than a year after opening, the Pittsburgh community was faced with a typhoid epidemic, which took the lives of 4 sisters, including Sister Xavier Tiernan, the first American Sister of Mercy. In addition to the deaths of the sisters and the fears of the sick, sisters had to withstand the hostility of nativism, jealousy at receiving public contracts, accusations of pressuring the defenseless sick to become Catholics, and a scarcity of both trained nurses and funding. Mercy's hospitals began during the final stages of the dark ages of nursing. Sister nurses had learned the ways of healing through lived experience, sharing the wisdom of McAuley, who nursed family members dying of tuberculosis and tended the victims of Dublin's cholera epidemic. Before joining Florence Nightingale on the battlefields of the Crimea, sisters like Mother Claire Moore and Teresa Maher had learned the importance of fresh air, good food, cleanliness, and the comforting word in the healing process. These lessons would be vital in the trials that lay ahead. The courage of Sisters of Mercy was witnessed by their commitment to the sick during the public health crises of their time. Typhoid, smallpox, cholera, and yellow fever epidemics tested their skills and their spirits. For their efforts, the sisters received the respect and support of their civic communities. To supply for the lack of trained nurses, the sisters established nursing schools in conjunction with their hospitals, asking of each nurse excellence, expertise in the best nursing practices, and hearts of mercy. Crises were common, and no crisis was more challenging than the call to serve on the battlefields of the Civil War. Over 100 Mercy sisters, 25 from Pittsburgh, nursed both the blue and the gray, bringing healing and comfort to shattered bodies and dying soldiers. From Stanton Hospital to Pittsburgh, West Pennsylvania Military Hospital to Shiloh, the sisters gave their lives, labor, and prayer to the wounded. The extent of the valor is felt in the words of Abraham Lincoln. I never knew whence they came, or what was the name of their order. More lovely than anything I had ever seen in art are the pictures that remain of these modest sisters going on their errands of mercy among the suffering and the dying. Mercy sisters were never timid in the face of need. Faced with insufficient medicines and food, they advocated for needed resources. Not accepting the no of government officials who refused such aid, they appealed directly to Lincoln and were heard. Healing and reconciliation was foremost in the work of the sisters. They tended each victim, holding them as ones of profound value and worth. They wrote letters, cooked food, changed dressings, and sat with the dying. They shared the hardships of the defeated and imprisoned. Some died in the process. Others, like Stefana Ward, a prisoner of war, returned home in broken health. Hospitals were not the sole venue for the sisters' efforts. In the midst of constant demands for expansion and updating, the sisters not only partnered with the medical community, but continued the work of visiting persons in their homes. This home visitation allowed the sisters to see firsthand the results of poor sanitation, poor food, lack of heat, and hopelessness. They identified the link between unacceptable social conditions and illness, as they found themselves not only attending to the sick, but acting as social workers, bringing food, clothing, and whatever assistance they could. Over the past 175 years, Mercy's dedication to the well-being of persons of all economic classes, ethnicities, and religions has blossomed into one of the largest healthcare endeavors in the country. With partners who share the same vision of excellence, compassion, justice, and dignity, it provides accessible care in a variety of venues. Through clinics established in rural areas, homeless facilities, and immigrant settlements, Mercy reaches out to those without health care. Virtual medicine initiatives bring advanced expertise to small communities and remote areas. Through Mercy Investment Services, the sisters join with hospitals and other religious communities in using their fiscal resources to advocate for needed changes in systemic practices that threaten the health of persons and Earth. Through community benefit grants, needed social initiatives like anti-trafficking work, mental health programs, violence prevention training, and wellness programs are funded, especially in economically poor areas. Volunteer medical teams bring needed services to economically struggling countries around the world that are lacking such resources. Like the sisters who have gone before us and laid the foundations upon which we build, today Mercy continues its ministry of healing persons and communities with more than 30 Mercy-sponsored ministries in healthcare, from Maine to California, from Guyana to the Philippines. True to our name, Mercy is our mission.